While I have you here, I think I want to ask one last question, which is a little tangential, but I think for our audience it might be instructive. So you're one of the top HIV clinicians in the world, and um, we've made such apparently good progress in developing COVID-19 vaccines. You talked about 7 months, and um, can you help everyone understand why we haven't been able to create a viable vaccine for HIV, which we've known about for almost 4 decades?
I think, Dennis, there are many reasons. Number one is they're two very different viruses. But number two is HIV in general, except for few cases, there's nobody that has been able to. Nobody is able to control the disease, and more importantly, nobody that we know has been infected and then recovered. So we don't know what the immune response to the virus is. We don't know what the immune system needs to do to control the virus. And what we learn over time is that the immune system actually does a good job controlling the virus, but then the virus mutates and is no longer controlled, and the immune system does, and the virus doesn't. So it's almost like every time the immune system produces something to control the virus changes and outsmarts the immune system until eventually the immune system essentially dies of exhaustion, and then the virus, kills the individual. That's basically what happens. So part of the problem is that HIV is really a very difficult creature, right? And you would have to have a vaccine that controls the virus not one time but multiple times. And that, I think, is one of the biggest challenges, is how do you train the immune system to do that? Because the immune system in a way is doing that, but is not doing it effectively. So I think that a vaccine for HIV, honestly, is a huge scientific challenge that is still trying to be understood. I think we have a lot of smart people working on it. I still yet to see something that says, looks like the exit. My hope is that, before I retire, we will have an HIV vaccine. But I tell you, I'll turn it back to you. The development of therapeutics and what you and others have done in developing drugs for HIV, in my mind, has been nothing but amazing. We have gone, in my lifetime, from seeing people die of this disease to see people live healthy, productive lives and have the disease and the infection control in a way that they don't not only live normal lives, but they no longer transmit to others. They no longer infect others. And that, to me, is just incredible. And what drugs have done to control HIV has been nothing but amazing. So I think we need to think about, again, I mentioned it earlier, treatment as prevention. How can we use treatment as a way to find prevention and stop thinking about, oh, vaccines are prevention, drugs are treatment. In fact, they're intimately linked, and really drugs and vaccines together work for treatment and for prevention.